So we're expecting the candidate to come in any minute.
Okay, yeah.
Oh, hello, Mr. Deckney.
Hi, good morning.
Welcome.
How are you?
This is Dr. Obama.
Hi, very nice to meet you.
And we've met before. You know that I'm
thank you
Marianne
very
Guerin, the administrator of this clinic. Okay.
Thank you for having me.
So Dr. Obama here is the medical director of the clinic, and she'd be someone who you're working with, so she's going to be interviewing you also. So make yourself comfortable, and here's a list of questions we're going to be asking you. You can have this list. Okay. And do you have any questions of us?
No, I don't have any questions right now. Thank you.
Okay, great. You know, I reviewed your CV. It looks very good. And we see that you meet the qualifications for this position. As you know, it's the coordinator of the internal medicine clinic, and you work with the physicians collaboratively, and you supervise the other RN staff, the LVNs, the NAs, and the clerical staff. Okay? So we're going to have questions that are related to your job, and to make sure you have the skills that you need to meet these the job requirements. Okay?
Okay, sounds good.
All right. So since you're ready, we're ready. Let's get started.
We're ready to go.
Could you describe a time when you had a conflict with a physician or other member of the healthcare team over the care of a patient, and describe how you resolved it?
I do recall a conflict with an MD one time where there was a patient who had excessively high blood pressure and no one had done anything to medicate it or bring it down. I brought it up to the doctor, and the doctor said, oh, it's not that big of a deal. However, I felt uncomfortable with that because the patient had really high blood pressure for the last 3 days. So I could tell the doctor was a little bit miffed that I brought it up to him, but I went about discussing what the patient's needs were instead of what I wanted, and somehow framing it in that manner, he was able to be more open to the suggestion of getting the medication, and eventually we did get a medication for it.
Oh, great. Okay. Now imagine that you're the nurse coordinator and one of the physicians is called out to attend to a patient in the ICU. Got a whole bunch of patients waiting. How would you handle those waiting patients?
Well, I would explain to the waiting patients that we do value their being there, and they are our priority also. However, we do have standard protocols that if a doctor who is on call for the ICU is called, that becomes the priority at that moment. And someone will come in to relieve them, or they will be back shortly, but we will make sure that they don't feel ignored.
You look like a nice young man. Are you married yet? Do you have any children?
Doctor. Let's get back to the job skills, okay?
Yes, please.
We're interested in how you interact with other team members. Can you tell us about a time when you had to correct or counsel another team member? Could be an LVN, NA, or a clerk. How did you handle it?
Well, I tend to get along with everybody. I don't really run into these problems a lot. I mean, maybe I guess I
Could you think about it and think maybe of a particular time when you did this?
Oh, okay. Okay. There was one time where we had a policy change on our hospital unit, and that would involve the CNAs and the LVNs also, and they had to change some of their practices. I had to approach one of them because they kept forgetting to start doing the new system of documentation. So I approached it in the manner of, I'm not trying to correct you or put you on the spot, but it's more of, I'm trying to make sure that that we're all following the protocol and that you'll be able to get your work done on time.
Very good.
Are you Filipino? If you are, from what of the Philippines are you from? And how long have you been in the United States?
I see you're licensed here in California, which is what's important. Doctor, that's one of the questions we don't ask. Okay, can we get back to the questions here?
Okay. Well, I was just wondering. I am from the Philippines, and we might have something in common.
Well, I appreciate that, but we really need to stick to the interview questions. Would you like to ask the next one?
Okay, here it is. Can you think of a time when you had a very angry or upset patient or family member? Can you describe how you handled the situation?
Actually, we did have several angry patients before, and it happens a lot. However, the way we approach it is We try not to take it personally that they're not upset at us in particular, that they're probably more upset at a system, or maybe something's not working for them, or they're scared. So we try to approach it from that sense of trying to understand what the focus of their anger is, and then we go from there.
So is that how you specifically have spoken to, can you think of maybe what you said to the families in these cases?
I did say, we understand you're upset and you're probably scared that you're here in the hospital and you're not getting the right answers, but let's sit down and talk about it and see what would you like to address first, and then we will try to explain.
Great. Now, since you're going to be responsible for scheduling, you have to understand there are 3 different shifts to cover the clinic hours. There's a 6 to 2:30, an 8 to 4:30, and a 12 to 8:30. That gets everything covered. Could you give an example of a time where you had to develop a fair rotation schedule for nurses or other personnel in your department? How did you do that?
Scheduling is a difficult task, but I do have a system that I like to use. I go through the roster of the staff nurses that we have on hand, and when they're scheduled at say a 6:30 a.m. to 2 p.m. shift for that week, I try to make sure that they're consistent for that throughout the week instead of changing it around in that way, if they can make appropriate plans for their lives outside of the hospital too.
Okay, great.
What clubs or organizations do you belong? I am a member of the Old Boys and Girls Club, and we love to meet together in the local TGI restaurant.
Well, I think what she means to ask is what professional groups do you belong to, like the American Academy of Ambulatory Care Nurses, and then how are they relevant to keeping up your job skills and your abilities to do this job?
Oh, okay. Well, I am actually involved in several nursing organizations, and I actually am currently an active member of the local chapter of our AAACN.
Great.
In fact, I am the educational chairperson, so I help to plan out our educational offerings. We are actually developing programs right now on how to deal with the highly infectious diseases in the clinic setting.
Okay, that's very interesting. Here is an ethical question, one that we have dealt with here. What would you do if you see one of the other healthcare workers getting something from the medication cabinet?
Well, I would step back and see the situation when it happened, and I would first confront that staff nurse that was doing that part, and I would try to engage and find out what was going on, what the situation is, and then after that I would go up the chain of command as prescribed and and report the incident.
Okay. One more question. As the clinic manager, you're going to be responsible for hiring staff in the future. Do you use any particular interview method yourself?
Yes, of course. Actually, I use performance-based interviewing. I'm sure you've heard of it. I learned about it in my master's program, and my current workplace actually has been using it a lot. Performance-based interviewing, or PBI, is a method to increase the effectiveness of the interviewing process in terms of selecting and promoting quality staff. With PBI, the interviewer carefully defines the skills needed for the job, and it structures the interview process to elicit really the behavioral examples to define past performance.
Okay, yes, I have heard that research findings show that the best predictor of future behavior is past behavior.
I think I may have heard of that also. Isn't that the method they sometimes call competency-based or behavioral interviewing?
Yes, those are actually other names for it. You know, when you ask the job-related questions in the performance-based interviewing format, it really helps the interviewers to better evaluate their applicants fairly. And it also improves the match between people and their jobs.
Oh, I could see that. Thank you again, Mr. Daconet. Now, we're still conducting interviews, still in the process, but I should have a decision, and we'll be able to get back to you by the end of the month.
Okay, that sounds great. Thank you so much.
Thanks.
Really appreciate it.
Thank you so much.
You take care.
Hello, students. In this PowerPoint, I plan to review the key points about interviewing that hopefully you picked up from the video that you just viewed. So, in looking at this, we're going to start at the beginning and talk about the interview. What the method we're using is the behavioral or performance-based interviewing. So what is that? It's a method of interviewing or selection developed to respond to a need to conduct interviews that can predict job performance. The underlying belief is that the best method for predicting future job performance is past performance. So in preparing these sorts of interviews, you want to come up with ways in which you can ask the interviewee to think of scenarios and times when he's done a skill in the past. The benefits of this, it assists you in making better selections, because if you make bad selections, it costs you money and it's going to impact the morale of your unit. It helps you focus on the skills actually needed for the position, and it meets the legal requirements. If you follow the performance-based type of questions, you're not going to be asking those illegal questions. You're going to focus on the skills related to the job. Okay, so step one. First, you're going to plan what you're going to do. You have to do some pre-planning. You're going to analyze your position to be filled, and you're going to look at some essential qualities. First of all, the technical skills or tasks that they're going to be doing, the performance skills, and then you're going to develop your list of performance skills. These could be things like ability to lead a team, ability to schedule personnel, ability to deal with conflict, all those sorts of things. And you're going to write your appropriate announcement. Then you're going to select an interview team. When you're doing this, you want to think of having the key people who will be working with the person in the position that you are hiring for. So you might want to have people they will supervise, as well as perhaps people from the interdisciplinary team. So step two, you're going to develop the interview questions. Identify the performance skill, which you've already done probably in step one, and then think of a situation where that quality would emerge. You want the interviewee to be able to describe a time when they use that skill. So use words such as, well, tell me about an experience when, or describe a situation when. So here's some sample questions. So if your performance skill was leadership, the ability to work with challenging team members, you might develop a question like this. Describe a time when a team member challenged a decision that you made, and then tell us about how you handled it. Here's another one. Maybe the performance skill is that they have to be able to deal with a lot of stress. Okay. So the question might be, tell us about a frustrating or stressful work situation and how you were able to deal with it or resolve it. Step three, conducting the interview. Okay, prepare the team, have pre-printed questions ready for everybody, and you might even have one to give the interviewee. Okay, set the site, make it a comfortable place. You don't want to be disturbed by other people. It should be private. The other thing, when you're doing this type of interview, I think one of the hardest things to do is to allow the interviewee to take time to answer the questions. And what will happen is they may pause because they have to go back into their memory and think of a time that they can describe that meets the skill or job performance area that you're looking for. So what you'll see is they will become quiet for a minute. Often they'll look up. You'll see their eyes kind of go upward. Don't interrupt them. Sometimes people want to help them out and give them ideas, like just sit quietly and wait for a minute. Allow them to collect their thoughts. Sometimes another thing that happens is that they will start rambling or talking about what they would do. As soon as you hear the word would, well, I would, or I think I might, they're not giving you a specific example of when they've done this in the past. So you need to interrupt and redirect them. Do it nicely, but you need to get them back. Stop them and say, I want to know a specific example or a specific time when you did that. I always give one of the examples, and maybe this is more related to silence, is one of my people I interviewed. We asked the question about conflict. Tell us about a conflict you had and how you solved it. And the person sat there and then finally looked straight at us and said, I've never had a conflict with anyone. Well, right away we knew they probably had and hadn't been able to handle them well, so it kind of ruled them out as a candidate for our position. So sometimes what they don't say is telling also. And legalities, keep a record, ask the same questions of everyone. I'm not sure in the private sector is as important as the public sector. I worked in the federal government, And if you asked one person a question, if, for example, somebody strayed and asked an additional question, you had to write that down and ask it of the next candidate. So you want to do that. Stay away from the don't asks. Ethnicity, marriage status, religion, all of those things. You don't ask those things. Okay, so remember, planning well and using this organized, proven method can really help you make the right selections. It can also give you ideas of how you might prepare for your own interview. You're going to go out and interview for a position, let's say. Come up with a number of scenarios that might meet the kind of things they're going to ask, even if they're not using competency-based. You can show them that you've done these things in the past. So in review, I want you to think about, what did you notice in the video interview? Review this list of things you noticed and decide if the participants did these things. Were they all well prepared? Did they greet the interviewee appropriately and attempt to put him at ease? Did they allow for silent periods after the questions were asked? Did someone keep notes? Were the questions performance-based, and were they based on job skills needed? So hopefully that scenario will give you ideas for your own interviews, whether you're the interviewer or the interviewee. So my little gem I like to include, it's smarter to work really hard to select the right person to start out with than to try to get rid of an employee who's not working out, especially if they're just borderline performance and there isn't something that's really a fireable or something to terminate someone for. So you want to create the team that you want by asking the right kind of questions. So you need to work on making sure your selection processes are excellent.